Did you know that Bob Dylan wrote a song about an epidemic? Me either. The song was Legionnaires' Disease, which was later recorded by the Delta Cross Band. Dylan wrote the song in response to the media frenzy caused by the deaths of 29 Legionnaires associated with a convention in Pennsylvania. Allow me to set the scene. Americans celebrating the bicentennial anniversary of the adoption of the Declaration of Independence by the Founding Fathers. Philadelphia being the home of the Declaration of Independence, the Liberty Bell, and the home of Paul Revere, Ben Franklin, and Robert Morris, was the epicenter of celebration. Over 2,000 members of the American Legion gathered at a downtown hotel in Philadelphia to join in festivities. Over 2,000 military veterans in a single hotel to commemorate the 200th anniversary of the United States, all during a heat wave. But then, the Legionnaires who attended the celebration between July 21st and July 24th, 1976, began experiencing symptoms including severe shortness of breath and high fevers that caused blisters or rashes. By August 2nd, 4 of the patients experiencing these symptoms had died without diagnosis. Dr. Sidney Franklin, a physician treating these individuals at the VA hospital, was mystified. Now, I'm sure you're wondering why your public health department is telling you this story. After all, this platform is to tell the stories of what public health does, and public health does not investigate deaths, right? Well, sort of. Public health officials investigate the spread of disease. Certain diseases are required by law to be reported to health officials. In some cases, like this one, health officials request support from public health institutions like the CDC when an outbreak of an illness cannot be identified. By August 2nd, Dr. Franklin had called the CDC, and a public health investigation into this mysterious illness had begun. While Dr. Franklin acted quickly, 182 Legionnaires had been diagnosed with this mysterious illness by August 15, 1976. The CDC and the Pennsylvania Department of Health identified that all the members of the American Legion must have been exposed to the same source of disease because everyone who contracted the illness was sick within a short period of time. The only location shared by all Legionnaires was the hotel where the celebration was held. Public health officials began investigating the environment of the hotel. Pitchers used to serve Bloody Marys were checked for metal cadmium, which can cause flu-like symptoms. Elevators, carpets, and walls were checked for contaminants. They even checked the rooms of long-term hotel residents for parakeets, which might cause another flu-like infection called psittacosis. Interviews, investigations, and testing continued until Christmas of 1976. At a Christmas party, a CDC official criticized Dr. Joseph McDade for not finding the cause of this Legionnaires' disease. After further tests and experiments, Dr. McDade and his colleague Charles Shepard discovered a rod-shaped bacteria. But where did the bacteria come from? It wasn't until another outbreak of the disease in the following year, 1977, that CDC investigators learned that Legionella bacteria grow rapidly in cooling towers of large buildings. The bacteria growing in the cooling towers can be spread through droplets traveling through the air conditioning system. According to the CDC, the rate of reported cases of Legionnaires' disease has grown by nearly 9 times since the year 2000. This increase may be due to awareness in testing, increased susceptibility of the population, or increased Legionella in the environment, or any combination thereof. Today, we know that Legionella bacteria are found in many freshwater environments like lakes and streams. Legionella can be a health concern when they grow in buildings' water systems like shower heads, cooling towers, hot tubs, decorative fountains, water features, and complex plumbing systems. Legionella bacteria still causes illness in individuals today. In fact, about 1 in 10 people who get sick from Legionnaires' disease will die. Both Pontiac fever and Legionnaires' disease are required by Nebraska law to be reported to the health department. These illnesses are investigated by public health officials to identify the source of the bacteria in order to prevent more individuals contracting the disease. In general, people don't spread Legionnaires' disease to other people, so the source is generally located in a person's physical environment. The key to preventing Legionnaires' disease is to reduce the risk of Legionella growth and spread. Building owners and managers can do this by maintaining buildings' water systems and implementing controls for Legionella. Luckily, most facilities have water management plans, and Two Rivers works diligently to identify outbreaks and solve the problem.